Okay, we are live. We are live on both platforms. We are on Instagram. Hey, Instagram. And we are on YouTube. Hey, YouTube. All right. Blow up the chat for me. Okay. We're going to get into this very, very unique case. Thank you for coming in. Thank you for coming in. Again, as I always say, your attention is so important, and it's a hot commodity these days, so we have to be very mindful of what we're paying attention to and what we're attentive to. Thank you so much for coming on in. This is a very interesting case. I want you guys to really share this live. If you're on YouTube, put something in the chat. Share it with family and friends. Peace and prosperity. Thank you so much. All right. All right. Before I share this photo, I want everyone on this live to understand and understand that it's very, very important to really be attentive to your health in every way possible. The physical aspect, as far as maintaining your physical body. The spiritual aspect, absolutely, because the spiritual body governs the physical body. So during this time is so important because we again, we are the diagnosers of disease, this body, this entity that we live and breathe in, right? And we're constantly bombarded with so much outside stimuli that we're not able to tap into that innate power that we all have to understand that we are the machines that we've been looking outside for. Yes, yep, go ahead. You can have the seaweed. You're welcome. All right, yeah, that's my daughter family. She asking for seaweed. Yes, so I'm just gonna go right into it. Oh gosh, I done messed up this thing with this filter. Okay. Look at this family. I want y'all to YouTube. I'm sharing the entire screen, so give me a second. All right. All right, YouTube, you should be able to see this. Instagram, let me know if y'all can see it. All right. Put some eye emojis in the chat, or just put a thumbs up. Eye emojis in the chat, or put a thumbs up. And then we're going to get right into it. YouTube family, not sure. I can't really see your the chat there. Oh, somebody called me on Instagram. All right. Y'all know what to do, Instagram family. All right. Let me just fix this thing here. All right. Y'all know what to do. Put something in the chat because someone tried to call me and it disrupts the feed. All right. So put something in the chat. All right. YouTube family, let me y'all put something in the chat too. Again, I can't really see it from my end, but I'll be able to see it once I turn it off. All right. All right. So this was a very interesting case. This is actually one of my students that's in my Detox with Iridology level 2 program. She took my program. She ended back in about May or June. So I've known this woman for over a year now. She's in the UK. Shout out to my UK family out there. And based upon what she's telling me, that the healthcare system is very different out there. Okay, they very slow to diagnose, or if they don't know what's going on, they this is from her words, that they send you home pretty much. And that's not the first person that I've had from the UK that told me this, and that I was able to help them to understand their health more so based upon their iris blueprint. It was another guy that I had in the UK, and it was the same thing. He had these issues with energy. He was always so innervated, and he was like, trying to figure out, like, he was always having these patches on his skin, these breakouts, and he just couldn't figure out, what was going on. The doctors there, they didn't know either. So they just told him, hey, we really can't do much for you And so they, like, even after running every test, still couldn't do much for him. So this is another person, like I said, that I had from the UK that has already stated the same thing. So within 55 minutes, which is the length of time for my consultations, family, all right, which is the length of time for my consultations, I was able to break down for her what was really going on, and what she needed to pay attention to, so that she can, live her best life possible. And that's what it's really all about, family. It's about understanding your health, so that you're not in pain all the time. You're not constantly running back and forth in a circle, because that's what we're doing. We're constantly in circles. Where you're going outside of the self, when everything, all that you need, all the answers you need, as you can see with me doing this iridology case, is right here within you. Okay. So if you're asking about the color of the eye, okay, this was my first time actually having this kind of iris. And what it's called a heterochromia, iris. Okay, you can look it up on Google. It's a two-toned iris, or what I call a two-toned universe. All right, because notice the eye mirrors that of what it looks like a planet. And it says online, if you Google, it says online that what it means is, it could be a birth defect, or an eye injury. But really, this is based upon what I have gathered, and the time I've spent with myself, of what this iris means, is those who have this specific kind of iris have dealt with so much, not just what they're going to possibly can deal with in this lifetime, but what they're bringing back in this lifetime from past lifetimes. Now, I only could say that as a theory, because this is the only person that I've had with this kind of iris. So until I have more cases and I get a backstory of their spiritual health, their upbringing, any kind of history of what we call abuse, that's when I can say, okay, this is where I can link it to. But I actually, if a while back, if you guys remember, I was going to do a live called the Two-Toned Universe, because this specific client has dealt with so much from childhood, on a spiritual aspect. It's like, coming into this body and someone just trying their hardest to break your resilience as a child. So that's why, a lot of this I gathered from my own downloads. But again, can only be tested more when I have more clients like this one. Okay. So you can see at the top, it says MC. All right. And you guys, if you guys are enjoying this live, you're enjoying this feed, put some ones in a chat, put some eye emojis in the chat, and make sure to use that paper plane at the bottom of the screen, Instagram family, and share this live. Okay. YouTube, same for you. You are not exempt. All right. Make sure y'all share this live, okay? Because we're talking about a live iridology study case that one of my clients in the UK has come to me, and I'm showing you exactly what the challenge is and how I was able to connect the dots for her. And that's what I do, y'all. I'm a dot connector. I'm a decoder. I am, and I help you to become decoders too. All right, how to perform just simple self-diagnostic tests on yourself, which saves you the trouble and the worry of constantly going to back and forth to hospitals. You don't need to do all of that, and at the rate that we're performing doing these different exercises, going back and forth to doctors, when really you're the self-diagnoser. All right, so you see at the top it says MC. That means main complaint. All right, so the main complaint that my student, she came back after 3 months. We had the program, it ended, and she came back after 3 months, and this is what she had to tell me, that she had excessive blood in the stool, bloating, a lots of bloating, and left side pain. So left side had a lot of she has a lot of belly aches on the left side of her abdomen. And so going to the doctors, they couldn't really, figure out what it was. They just kind of just drummed it up and said, hey, it could be hemorrhoids. Right. And that's what most people deal with. That's actually a common challenge, what is called hemorrhoids. And hemorrhoids, most people don't know, but I'll just, we'll just talk about it here. Right. Hemorrhoids is the swelling of the anal area, the anal tissue. And that is a direct causation of constipation. All right. Hemorrhoids is a direct causation of constipation. All right. So if you may have it on the exterior where it's very painful and it's very like irritated, and that's where the blood comes from, or it could be internal inside the anus as well. All right, but this wasn't her challenge. I mean, she checked her she had no pains in the anal area, even though that doesn't mean that the anal fissures were not compromised. So she was having like, somewhat of regular bowel movements. And keep in mind, family, I want you to pay attention to this very important statement. Just because you have daily bowel movements, that doesn't mean that there is not intestinal irritation happening. All right. I think we think because we go to the bathroom every day, all day, that, we have healthy bowel movements. So if you're eating 3 times a day, of course, yes, it should match up to having that many bowel movements. And if when we go to medical physicians, they'll say, oh, 1 bowel movement every other day, it's fine. I had a client so backed up, family. This is not a joke, that they were so backed up. They hadn't pooped in over a week. And the doctor said it was fine. And you know what I said? I said, next time you ask your doctor how often they poop. Yeah, make sure you ask them how often. And there's your answer right there, family. Okay. So, we have to really understand that the body has to constantly evacuate waste every day, and especially at the rate of the meals you're eating. And then on top of that, we could be carrying waste from meals that we've eaten last week, meals that we've eaten 6 months ago, meals that we've eaten in our teens or in our early 20s. So, the body is so intelligent, it'll constantly try to get it out. But if there's some kind of blockage, it'll be very hard. All right. So this was the main complaint, family, here. And like I said, they couldn't understand what was going on. And so when I looked in this area, if you see the arrow pointing, family, put something in the chat. If you see the arrow pointing, it says the mesentery region. Okay, well, actually, I'm skipping ahead. All right. If you see the arrow pointing to the pupil where it says intestinal compaction, put something in the chat. And that's for YouTube and that's for Instagram. YouTube and Instagram. Put something in the chat if you can see that arrow pointing to the pupil area. All right. So, all right. So here you see it. I have my cursor on for YouTube. All right. So here you see that. You see how dark it is, family, around where the arrow is pointing? That's the intestines. Okay. And that's the lining of the intestines. So you see here what I put: intestinal tract compaction. So already right there, that lets me know that there's, even though she's going every day, there's so much waste compaction that it's irritating the large intestine to where she could have any kind of polyps, right? The polyps could be irritated to the point where she's experiencing excessive blood in the stool, right? So then you have this other area, which all of this ties into the entire aspect of what she was dealing with. All right. It's called the mesentery region, right? And not to get too sciencey, but we're just going into it because these are things that you want to remember and you want to pay attention to. So if you've ever or know someone who's ever experienced this, or how to avoid these things, right? Right. So the mesentery, think of it like a fold of tissue in your abdomen. Actually, that fold of tissue helps to keep your digestive organs together. All right. It actually holds it into place. And a lot of people who have like prolapse of the colon, that mesentery is damaged. Okay. And also, the mesentery is so powerful because it actually holds a lot of lymphoid tissue. All right. Put some ones in the chat. We're not going to get too sciencey, but put some ones in the chat if you're still tuned in with me. So we all heard by now, a lot of us have heard the word lymphatic, lymphoid, lymph nodes, all of that. And really what that is your defense system, because it houses all of these lymphocytes, which are your military system. All right. It's your own system, your own military system, there to constantly defend and protect you, never against you. But again, if you have this divine intelligence, which we call the lymphatic system, has the, and then these different parts of the lymphatic system, which is all spread in line in your colon, in your gut. And we're constantly bombarding this military with these pathogens, these invader cells we call viruses, and bacteria and parasites and all it is. The military is going to get tired out. They're eventually going to get wiped out, right? So we have to do things to strengthen that. We also have to recognize the triggers. We have to recognize our food intolerances, and that's what this area is dealing with. Family is dealing with something that she's eating is rejecting, the body's rejecting it, because again, all of that fold of membrane has all of these lymphocytes lined up to help and defend you, right? So that's what these that area deals with. It deals with recognition of the food intolerance, the dairy, or whatever you're doing on a daily basis. Think of all of that you're eating, and you're having these different pains or bouts of excessive bleeding right after that. So that's what I'm telling her. And she's tuned in. And most of you know, who've had an iridology done by me, know that it's not just, oh, me sitting up here and talking to you. Just the way I'm talking on live is actually how you're going to experience me. Me giving you an education lesson on who and what you are, right? And not getting all like with the big words and the medical jargon, because really medical jargon, they use a lot of Latin terminology, which is to further confuse you so you don't ask questions. That's what it's all about, so you don't dive deeper. If the doctor says, yeah, so you have colitis here, and then that's what the blockage is, but no worries, we're going to actually have to take your gallbladder out, and just using all of these different this jargon, because you don't really, the average person doesn't understand how to combat that, right? So that's why it's so important to know constantly what you have within you. All right, there's no other greater study than constantly studying the self. All right, because and if we don't, we're going to be bamboozled. All right, that's just the bottom line. So once I've explained this to her and presented the information to her in this manner, the next thing I said was to say, here's the best thing that you need to do right now. You need to do a liver flush. You need to do a liver flush. All right. Put some eye emojis in the chat if you can see the yellow in the white part of the eye. Put some eye emojis, thumbs up, whatever it is that you want to do. YouTube, Instagram, put it in the chat if you can see the yellow in the sclera. And again, don't forget to share this live because this is information that is not privy to us constantly. All right. So here, YouTube family, you can see it more because you see my cursor on it. But if you see it, Instagram on the other side of I'm looking at it from my left side. So you could be looking at it from your right side. So you see the yellow in the sclera, which is the white part of the eye. That's the liver. All right. That indicates fatty liver. And if you're just coming in, we're talking about a unique iridology case. from one of my clients who I had the permission to share their iris. Thank you all. For those who are tuned in, thank you all for joining. All right. All right. So if you see that yellow in the sclera, that's the liver. Okay. So that indicates to me fatty liver. That also indicates or possibly can indicate bile duct obstruction, right? So I talked about that a lot. What happens when the bile ducts are obstructed? Not enough bile, poor digestion. Poor digestion. If you don't have enough bile, the bile has to first be produced by the liver. Once it's produced by the liver, then it's stored in the gallbladder. Then the gallbladder, from different stimulation, from hormone stimulation, then opens up, dilates, contracts, and then sends it on to the duodenum, which is the opening of your small intestine. And then that's when you're able to digest fats easier. Okay, that's when you're able to digest fats and proteins and carbohydrates and break that down without the bloating, the flatulence. So if you deal with all of that, that tells me right there that you need more bile in your body. All right. So that's the next thing she asked. Well, how can I do that? How can I get more bile flow? Right. Because also what she was dealing with was acid reflux. Right. That's like a common thing. And people are like, oh, like acid reflux, da, da, da. Really, but it's so simple. Acid reflux is just you have a liver challenge, liver and gallbladder challenge. And then what happens is when you don't have enough bile to kind of neutralize, because see, bile is naturally alkaline, right? It's like a pH of like 9.6. So when you have this bile swimming in the stomach at the same time of the hydrochloric acid, which neutralizes that, then you're able to break down your foods without the flatulence and all of that. But when you don't have that, that's when the acid reflux happens. You have the belching, the bloating, because you have a lot of fermentation, right? So the next thing she's like, well, how do I do that? Well, you have to unblock the ducts. You got to get that open. See, this is what this universe is about, constantly being open. All right. Everything being open for flow. Right. And we look at it like I look at health. And this is why, when I do and have my iridology consultations with my clients, it's like no other, because I'm just showing you who you are. And then also helping you to break down your personality, helping you to understand, how we got to this point so that you can detox, not just on a physical level of, oh, here, take this herb for the liver, cassia and mandrake and milk thistle and bilberries and all of these different herbs. No, but it's more so going deeper into that, right? So if you've heard me before, I'll say it again. The liver deals with a storage of anger, right? So whatever happened throughout your life, if you held on to all those experiences, well, that's what's going to happen. That's going to be cut off and blocked. It's going to be tight. It's going to be hard. And we need to be loose, baby. We need to fly. We need to be free from all of that, because one of the Buddha quotes that I love so much, and I had on my Beta Waters website, and I'm going to talk about that in a minute, because I got to get that website up and running because it's under construction. But in the end, only three things matter, family. And this is a Buddha quote. In the end, only three things matter: how well you loved, how well you lived, and how easy it was for you to let things go. All right. And it's such a powerful tool that you can utilize. You can hang it up on your by your bedside. You can, plaster it in certain places so you can be reminded of that on a daily basis. Because I don't think we realize, as carrying this avatar, that we're more than just that. And when we constantly bring past experiences to the present, it actually damages the organs in real time, family. All right. So that was the suggestion I had for her was a liver flush ASAP. All right. And what that's going to do, family, all of what we talked about thus far, if you're just now joining, we're talking about what this client had a challenge with, that she could not get answers from her medical doctor. Family, I spoke about this last week, that your what did I say? Your physical is not enough to detect disease, because you have test after test after test after test and still can't find something. I was speaking to a parent the other day, a very close person to me, and she took her children to the doctor, and I've known her for years. And family, when you're in this kind of line of work, I have to learn to not take things personal, because you have family, you have certain people that you called friends, and they still, confused as to what you really do. I'm out here, I'm doing this. So I don't take it personally anymore, because it's in their own time, right? But she's telling me, she's like, yeah, the doctors are trying to check to see why such and so is gaining so much weight rapidly. And she's a child. She's like, 10, 11 years old. So she's just trying to figure out why she's gaining weight so rapidly. They ran every test, thyroid, they checked if she had pre-diabetic or whatever, nothing. And she was like, I was thinking about doing those genetic marker tests where they could check your blood to see if you're prone to cancer, if you're prone to this. And I'm like, that's what I do. I'm looking at her and I'm like, that's what I do. But it didn't matter, family, because she still sees me from 10 years ago. So you got to also be careful when you're evolving, or you have evolved from a point of your life where you're no longer where people want you to be, or where they still see you as, you have to separate yourself. And I don't really spend too much time in that circle, only like kind of passing by. But yeah, that was like the kind of like dialogue that kind of happened. All right, so that's what you're seeing with this iris, family. It's intestinal compaction, it's lymphatic, definitely, as far as it being on guard and being as a defense. Notice that if you guys see that hole, put some ones in the chat. Y'all see that hole, like it looks like a teardrop? YouTube can see my cursor on it, but Instagram, you should be able to see it too, because I took my time and put arrows. Okay, so if y'all can see that, put some thumbs up, eye emojis, whatever the case you want to do, you want to put there. And also, if you have questions, go ahead and ask them now, because we are hitting. I think we hit the 30 minute. We 30 minutes in. Yeah, we about 30 minutes in. We cooking right now. All right. All right. So you see here that what we call a lacuna in iridology. That is, you see with the arrow point, right? Groin, inguinal nodes. Inguinal nodes are your lower extremity lymph nodes, which is usually housed in the groin area. So family, if you've ever like, hold on one second, right here. So if you ever like felt like any kind of like pain, like right here, any kind of tightness right here, and it's unexplained, any kind of swelling or lumps in that region, that's dealing with the lymphatic system here, which is going into that's the lower extremity. So here, that all stems from the colon. Poor lymphatic flow, poor circulatory flow to the lower extremities. And then people who deal with that, you're going to have issues with the legs, right? Possible swelling or edema, right? Which actually she deals with. She has to wear these special socks because the swelling gets so bad at times. So all of this, family, I say all of this, and I hope I made it as simple as possible. Please tell me I made it as simple as possible. Please put it in the chat that I made it as simple as possible, because being a healer, a teacher, or really, I'm just giving you the door. I'm not doing anything special that you cannot do on your own. I'm just showing you the door, and your door, the windows, is the eyes. That is how you walk through it. That is how you get through any kind of physical, spiritual challenge. And then you have to use the other ologies, as I talk about all the time, to constantly reinforce your path. You're not living, you don't have dis-ease by what Reverend Ike says, dumb luck. This is not by chance. Oh, F cancer. Why me? F this. Why me? No, you're not following your divine path. And we all have an assignment here that we came to do. And some of us, we choose to ignore it, or we want to stay stimulated and inundated with the constant matrix flow that is happening. And you see, baby, you see that it's all tearing and coming down. So if you don't stay up to date with who and what you are, you're going to be in trouble. So here I am showing you what you are. Okay. So here again, poor lymphatic flow really stems from the gut and also the liver. And then she said that she was dealing with left side abdominal pain. So on the left side, that's where your spleen is. All right. So I asked her if it's tender to touch. So these are different questions that I asked if it's tender to touch, because that can mean that can mean it's an infection or severe infection, right? Even though it's not tender to touch, it doesn't mean that it's a severe infection going on. Infection means defense. Infection is your defense system. So we have to work with it instead of bombarding the body with, outside drugs and prescriptions to try to lessen that. And then even getting a spleen taken out. They take out spleens. Actually, when I first started really doing iridology heavy, I was at this conference, and I was giving iridology to the people there. And I said to this one guy, I said, I was still fresh, right? So I'm just still using my chart, and I'm still going back and forth. And I'm like, there's like a big hole in your spleen area. Can you tell me about that? He was like, shut the door, because he was a skeptic. He came to this conference, y'all. He was a skeptic. He was like, oh, I want to see if this is real. Because I have a lot of people like that. They be like, I want to see if iridology is real. When I said that, he almost hit the floor. And he was like, I had my spleen taken out because I had a really bad infection. And at the time, like, I didn't really do a lot of research and study on the spleen. And after I realized, I'm like, the spleen has the most lymphatic tissue out of all the lymphatic organs, right? That deals with your red blood cells, your iron absorption and production. It deals with all of the lymphocytes, all of the infections and things that you're privy to, tonsils and all of that. First line of defense we know is the tonsils, but the spleen family plays a huge role in your defense system. So that's where the left side of the abdominal pain was stemming from. All right. Again, constant. It's like the body's irritated, right? And then remember the other day, if you were tapped into my last live, if you didn't, just watch the replay of the arthritis plot, which I didn't show you guys what arthritis looks like in the iris, right? You see like these white specks on the outside of the iris. You see these white specks. Put something in the chat, Instagram family. YouTube can see it. And if you want to go on my YouTube, it's Holistica, the Master Iridologist. These are these white specks on the outskirts of the iris. That is how we can tell if a person has some type of what you call arthritic condition. And she was diagnosed with what is called osteoporosis, which that falls under the same family: joint, bone challenges, cartilage issues, all of that. All right. So this is, I want to make it just keep it like simplicity is the key, right? So that you can really spit back verbatim, what I'm saying, so that you can not only help yourself, you can help your mother, you can help your dad, your aunt, someone that's going through colon issues. Because, oh man, family, the colon, it takes years for the colon to, catch up, depending, right? There's some people who deal with stomach and colon cancer issues in their 20s and 30s. So it just really depends on the individual and their resistance. It really just depends on, case by case. We go case by case, but not saying, oh, you're in your 30s, You'll be good until you're no, never take your health for granted, because that 50-year-old self is with you right now. That 60-year-old you, it's inside, it's with you right now, right? So the high blood pressure and the, possible what they call the cancer and all of that is right here with you, but you can choose the path that you go down based upon you staying abreast on your health. Family, I cannot, put this in other words to, really, this is your blueprint, your God-given blueprint, which is your iris, right? And in later years, they started calling it iridology, right? What they coined the father of iridology, Dr. Bernard Jensen. But before him, where did he get his information from? Right, all of this is stemming from ancient Kemet, all the way also to the Chaldeans, which they found that when there's certain kind of ailments, or someone had a broken knee, or some kind of challenge, that the eye color changed in that region. You Instagram family, let me know if y'all can hear me, because I'm getting these calls and I can't answer the phone right now. So let me know if y'all can hear me, because sometimes when calls come through, it stops the live. All right. Let me know if y'all can hear me. Put something in chat, Instagram family, YouTube. I know y'all can hear me. Hello, doctor. There is a member of the LA. Yes, I know who she is. I forgot her name. That's crazy. Yeah. Hello, doctor. There is a member of her dad was in the NBA too. That's how I remember her. Her dad was in the NBA too. So she was already like from young to be playing basketball. Okay, who was having to miss games because of Crohn's disease. Can you? Yes, absolutely. Absolutely. Matter of fact, Crohn's is a weakness within my family health history. Crohn's, all of that falls under one umbrella, which is intestinal inflammation, colitis, Crohn's, IBD, irritable bowel. What is it? IBD. They call it IBD, irritable bowel disorder. Then you got IBS, irritable bowel syndrome, and then you got diverticulitis. All of that falls under the same umbrella, right? So yeah, definitely, there's some of the same protocols that I'm, shared during this live for this lady here. It's the same that some of the same that will be for her as well, be a little different, but it'll be the same. It's all about really recognizing your food intolerances. That's really what it is. And at no given time, family, there's, nothing that we can give an excuse for, but there's nothing in the body that can digest dairy protein. Absolutely, absolutely not. You cannot, you don't even have the structure to break down lactose. So that's why all of this bacteria builds up. Then all of the and then all of the everything in the colon gets fermented old. That's why when you sometimes people pass gas or poop, if you could sit in the room, a closed little room, with your feces and your poop, you can't. If you can, right? But if you can't, that shows you right there that it's something that is decaying in the stomach. All right. So dairy is just one of those things that I just never suggest, right? Finding alternatives is the key, but also be careful, because they have weaponized the plant-based culture as well, right? So less is more, less is better, less ingredients. Some of my favorite brands, people who are yogurt people out there, I like Foragers. They're pretty cool. I like there's another brand in Whole Foods, in the health food store, that I like as well. I can't think of the name. What else that people like is, of course, coconut milk is a really good replacement if you used to like cow's milk, or, you know, when you're baking and things like that. For my bakers out there who have, you know, just, oh, I make cake. I just made a pineapple upside down cake like 2 weeks ago, right? And just use all plant-based ingredients, right? So it's just all about, you don't have to change the menu, you just change the ingredients. But you have to, it's a practice. You got to condition yourself to do it. It's like anyone who's working out. You haven't worked out in a while, the muscles become flabby, right? So you have to condition your mind for that new change that you're wishing and desiring to do. All right. So I trust I answered the question. Yes, I can definitely help her. I'm actually gonna follow her. I forgot her name. I think, was it Jazz something? I'm not sure. I have speech issues. Sometimes can't talk. I have was diagnosed with a neurological movement disorder. I believe it's nerve related. Have you ever came across issues like this? Yes, but there's something more to it. Like there's more root to it. Where were you in some kind of car accident? Um, um, we take a when it deals with speech issues. That's the part of the brain area. Let me see if I got it here. It's the cerebrum area, the psychological brain, which deals with that's part of the brain is called acquired mental speech. And then we look at the cerebellum as well. So I have to ask if there's any kind of you know, challenges when it comes to, you know, car accidents, what else, any kind of if you like had a hard hit to the head, any kind of medication, Lexi, that's what I mean. Any kind of, yes, any kind of medication or anything that you may have taken that may have excited that childhood trauma. Okay. Okay. So yeah, this is what I can say to you while we're on this live. I definitely suggest that you do a full iridology. But what's happening is there's a part of the brain, and don't quote me, the Broca's speech area, right? Where that deals with also tying into memory, the hippocampus. So a lot of times when we have, see, the hippocampus stores so much information, not just from this lifetime, but from past lifetimes as well. It's like a whole library of information of what you are. So if you're bringing, you know, like the past traumatic experiences and constantly holding it in, it's that area, the hippocampus, becomes inflamed, right? And so you will have challenges as far as memory, as far as trying new things, taking risks, being very hesitant, being very tight and closed in. And then it also can affect your speech. I also talked about this at the Nicholas Brooklyn event, you know, where I had a client dealing with something similar, where the speech was delayed, or not delayed, they were stuttering a lot, or they were having issues where they couldn't remember a thought. Okay, so what I would suggest, you can do what is called a past life regression session. um I can't think of a name of a person to really suggest. I actually have to get one for myself, but I also would suggest a full iridology too, so I can see what's happening in the entire body. You know, I look at the brain areas, which is the top of the iris, and then we go around the iris as a clock, because as I've said many a times before, the iris going around as a clock is literally the timelines of disease, right? So from 12 o'clock all the way to 11 o'clock, the 12 o'clock area, depending on how we're looking at the iris, shows the timeline from when you were a child, if you dealt with this, all the way to a middle years, all the way up to in the now. Okay, and it shows the timeline of disease of what your parents may have went through, grandparents may have went through, aunts and cousins and all of that. Now it may show something in one area, but like, wait, my cousin deals with that disease. I don't have that. Well, you may not have that specifically, but it's definitely an inherent weakness. that we have to make sure it doesn't become activated. All right. And nobody has anything. Don't own anything. That's another thing. Stop owning things. Oh, I have a headache. I have this. I have that. We have to speak, because remember, the subconscious mind is always recording what you say. So if you say, I have this, I can't do this. Well, that's exactly what it's going to be. All right. So wisdom is she. Underscore. I definitely suggest a full iridology, and also taking a look into the term past life regression. Anyone who's on this live and knows a good one, just tag them here, because I don't know one specific and I can't think of their name. And I actually need one too, because I've been wanting to have one for a while. Yes, you're very welcome. You're very, very welcome. Thank you for your questions. Anyone else who have questions? We are about to end this live in the next 5 minutes. All right. I touched on everything. Yeah, actually I did. All right. So yeah, actually when I get more research and information on this specific kind of iris, and a lot of people have never seen an iris like this before. Right? Both of her eyes have this blue at the bottom, right? The blue iris and the brown iris on the top. Okay. So some people may have seen it. Some people may know someone who had this kind of iris. So yes, it's a very unique, uh, you know,